Hey y'all, welcome back to my channel. Here is another update on how it's been for me being a new grad registered nurse. If you've been watching my latest videos, I've tried to do like this new grad RN chronicles to where I kind of detail how it's been working in an acute care facility or a hospital on a med-surg floor. Just trying to document my feelings as I go along, getting oriented in just becoming a new rad nurse and fulfilling my dream of getting there. So the update since the last time I talked to you, I know I was venting a lot about how people treat each other in acute care facilities, and namely how doctors talk and other nurses. Well, something else happened. So my shift, I believe it was last Monday, I got on the floor early. My shift starts at 7 and I usually get there around 6:30. So I have 30 minutes to look at my patients. But unfortunately, there's a day shift nurse that doesn't have report, or doesn't have the patients that we're assigned to. She doesn't have them up. She just, for whatever reason, hardly ever has them up. She could be busy during day shift. I don't know what's going on. But she just hardly ever has them up. And as a new grad nurse, this gives me so much anxiety because I won't know what's going on with my patients in time. So about 5 minutes before my shift starts, she finally has or gets the patient assignments ready. And, she does this thing where she doesn't start on my end of the room because, that she just never starts there. She starts with the people she's familiar with, so she goes to the other side of the room. I just get up and I walk over to her and just jot down my patients that I'm assigned to, and I go back to my computer. I have no time to look up my patients, just their meds and when they're due, and so I organize that and then print out these report sheets so I at least have the labs, their diagnoses or whatever. I have it with me, but really I have no clue what they're there for on a surface level. I just know if I read it off this sheet. So I'm walking around. 4 of my patients are with one day shift nurse, so I'm just walking around with this nurse trying to get as much information from her as I can. She's a seasoned nurse, so she is just shooting information out there at me, so I'm trying to jot everything down. One particular patient, she tells me, has a high blood pressure, just got admitted to the floor, has a systolic blood pressure of 203 over something, I forgot what it was, and just tells me that the doctor wants me to keep an eye on it. Lo and behold, as she's talking to me, that doctor comes rushing in and I need you to take her blood pressure. When was her last blood pressure? When was this medication given? Blah, 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 blah. Oh, I'm sorry to interrupt you guys at change of shift. I just really need this blood pressure before I go home for the day. And then so we run and get a vital sign machine. We try to take the blood pressure. She didn't want that blood pressure. She wanted us to take it manually all of a sudden. So we go and we run and we try to find a manual blood pressure cuff thing, and we find one and we take it, and it's still around the same. So she's not shouting, but she's just shooting off things for me to do as far as the hospitalist is concerned. Okay, let the hospitalist know the last time clopidogrel or clonidine was given. Let him know that Lasix was given. Let him know that her blood pressure's this, and this, that, the other, this, that, and the other. I'm jotting it down. And she leaves for the day. And then my day shift nurse just, takes me through 2 more patients, and again with the speedy report, and I'm trying to catch everything. By the end of it all, I still don't know what the hell is going on with my patients. I just know I wrote down a bunch of stuff, and I need to make sure I keep track of this lady's blood pressure, blah, blah, blah. And I can't even get my bearings about me. I'm trying to figure out, okay, who do I start with? I need a vital sign machine because somebody stole mine. I need to figure out what to do. And then in the meanwhile, 2 other night shift nurses passed me, and they're like, oh, Delilah, your patient in room whatever is saying that her bed is on fire. her bed's not on fire, but she just smells smoke or something. And they've had her before, and they told me that she's very, very needy and blah, blah, blah. So I go in there first to address that issue. While I'm in there, I figure I'll give her her meds, cluster my care, give her her meds, take vital signs, do my assessment. And also in her order, she has wound care due. She had like cellulitis and her leg was leaking, blah, blah, blah. And I just wanted to address her first. She was the most neediest person and wanted to do that. So I'm in there doing that, trying to get all this done. I get interrupted by a call on my Vocera, which is like a walkie-talkie system. And they say that that doctor that came in asking for the blood pressure, she's on the phone. So I go over there, I talk to her, and she wants to know the latest blood pressure again. And I'm like, oh, I haven't been in her room yet. I'll get the blood pressure. I'll let you know. I'll call you back. She said, okay. So I run in that room, take the blood pressure, let her know it's still high in the 200s, systolic blood pressure. And she, again, tells me things to do as far as the hospital is. And I'm jotting it all down. I repeat it back to her. She said, yes, perfect. And then I go and I Tiger text, which is like a texting system. I text the doctor all this information, ask him what it is that he'd like to do. And usually doctors take a while to get back to you. And so leave it at that. I go back into my patient's room to finish up her wound. It wouldn't have taken me long. I had like about 10 minutes left in dressing this wound and making sure she's okay. Get that done. I rush on over to that lady's room, take her blood pressure. It's still high. I noticed that she threw up. I wasn't even in there for 2 minutes yet before he comes in through the door, that the hospitalist. And this is his attitude. Hello? I am not one of these doctors that doesn't respond quickly. I need to know when was the last time the medication was given? And I'm just sitting there stunned. Like, I just walked in here and I've never met this doctor before. Mind you, he's never met me. I just walked in here. I'm stunned. I'm just like fumbling at the mouth, and he's like, just going in on me. And he goes, "Did she just throw up? Oh my God, that's throw up on the floor." That's how he's talking. And I'm like, yeah, I think it's throw up. I just got in here, and we'll get that cleaned up. Oh my God, is this her blood pressure? No, this is no good. This is no good. Yeah, it's no good. That's what I text you about. That's what I'm thinking. But like in my head, I'm like, why is this doctor talking to me like this? And then he's like, so when was the last time the medications were given? Well, I was looking it up and it was all on the computer right there in front of me. And then he was just like, so when was it last given? And I'm like, well, I don't see the last time it was given. Well, day shift said that they give it. Why didn't they give it? Why didn't they give it? And I'm like, I'm not sure if they give it. I just don't see it. And then he just like walked out. He's like, well, make sure you give it and give it sublingual. Okay? Sublingual. And then walks out. And I'm just stunned. And the CNA comes in and she cleans up the throw up off the floor. And I'm taking the blood pressure. And I'm just like, in my mind, I'm just like furious because I'm so sick of this. And I'm also trying to put in the correct order, which he should have done himself, but he did not. Trying to find that medication that I need to put in the orders and find it sublingual. Couldn't find an option for sublingual. So I go to my nurse's station and talk to my charge nurse because that's the question I'm going to ask. And she goes, Delilah, the doctor just came in here and he wanted to know why the medication wasn't given. And I'm like, I'm not sure if the medication was given because I didn't see. Cuts me off. Why wasn't it given? You should have given it. Why didn't you give it? She was talking to me like this. Again, I'm stunned. Like, so you're not going to let me talk? And another nurse was talking to me at the same time. He was a preceptor of mine. And I turned to him like wide-eyed, like I'm about to go off on somebody. And he kind of reads my expression because he heard the charge nurse suddenly yelling at me. So he comes over and he's like, well, take a look at your screen because it looks like day shift did give it. but it's due now. He's talking to her calmly, like just trying to help me out. And she's like, oh, okay. No apology to me. And then I'm like, so the question I came in here to ask is, he said to give it sublingually, but I don't see an option for sublingual. And then the guy is like, I don't think you can give that sublingually. So just put in an order for, the regular medication. I was like, okay, great. So I go back and I do that. Give her the medication. It's just long story short, give her the medication. That didn't work. I checked her blood pressure 15 minutes later, 15 minutes to 30 minutes later to an hour, one of those. And it was still the same. It was still high. And I tell him there's hydralazine PRN and I'll give that. He says, okay, fine. And I give it, didn't work. And then I notify him again of the blood pressure and that it didn't work. He puts on a different med on there and I give that and it brings it down some. I notify him, ask him, does he want to do anything? And anything further? And he goes, nope. And so I just leave it at that. But around 5 o'clock in the morning, I retook her blood pressure and it did come down to like systolic blood pressure around the 140s. But I just did not understand that. Like after that day, I was just pissed off. Like I don't understand how they talk to people this way. I just don't. But aside from that, my last 3 shifts have been on a COVID floor. And I've been taking care of patients that have COVID. I work at a small hospital, so we have a 10-bed ICU, but there has been, obviously, as you know, this explosion of COVID, and so they have taken over our 4th floor and our 3rd floors. 2nd, 3rd, and 4th floors are usually med-surg, but they have allocated the 4th and the 3rd for the overflow of COVID. So for me being a new grad, they assigned me to the 4th floor. They needed more nurses, and they assigned me to the less critical patients. So the first night I had 4 patients assigned. They were on high flow nasal cannula. And so it was pretty easy. It was a pretty easy night. They all had medications due at like around 9 o'clock, and they try to limit your exposure for you to walk into the room. So everybody has a window. So in order to check in on your patient, you just go to that window, you take a look at their oxygenation levels, their SpO2, their heart rate, you put eyes on them, you see their chest rising and falling. All the patients were ambulatory, able to use the bathroom on their own on that first night anyway. And so it was a pretty easy night for me, lots of free time. Talk to the nurses in the nurses station. It's a different group of nurses. They're all older. They were really helpful and very transparent with what they didn't know, just very willing to help me. 2nd and 3rd nights there, I had most of my patients were the same, but I discharged one. And then I had another patient that was on OptiFlow, and one of my other patients was on OptiFlow too. He got put on it during the day shift. And so OptiFlow is like a step before they intubate you. If you don't do well on OptiFlow in my hospital, they're going to intubate you. And so I had to keep eyes on 2 of my patients. If you have patients on OptiFlow, the maximum amount of patients you're going to get are 3 for the whole shift. And so 2 of my patients on OptiFlow weren't doing so well during the shift, and so they started to desat into the 60s. From like 95, they went into the 60s, and so I just ran in there and I proned them, flipped them on their stomach, and their oxygenation level went up. And so I was just doing great, and it was just a different feel, especially from the nurses up there. They were like telling me how great of a job I'm doing, very willing to help me when I asked for help. It was a different feel. I don't know if it has anything to do with me being on the 2nd floor and working with nurses that are mainly in their 20s versus nurses that have been a nurse forever and are older and more mature. I don't know. but it seems to be a difference. Other than that, my hospital has been calling almost every day to get people in to work a shift. They've been offering pandemic pay, which is like, I want to say $50 on top of double time, double what you make, and $50. I think it's double what you make plus $50 an hour on top of that, something like that. I don't know, but it's like the highest pay they offer or something like that. And so people have been picking up shifts left and right, except for I said, because I don't want to burn out. It's not that I don't want to help people. I help people to the maximum there with anything that I know, but that's only when I'm scheduled for a shift. But other nurses, when I was on the second floor for my previous shift, it seemed like they were trying to make me feel bad that I have not picked up a shift. And these are the 20-somethings that I work with, because they're there to make their money, especially for Christmas, and I don't knock that. They don't have no kids. They don't have anything else they'd rather be doing. I'd be doing the same thing. But to explain this to them was kind of hard, that I have kids that I'd rather see. And if the hospital was offering time versus money, I like time off, like vacation. You know, this is like unheard of to them. They're like, what do you mean time? Like, like time, like sick time and extra vacation time. If they were offering me that, I'd be more prone to take it. But like, just offering me money is not going to help. I want some extra time with my family, and I don't want to burn out. I'm already exhausted getting off of my regular shift, and if something were to happen to me, like I get sick, I just rather spend my time with people that care if I disappear or if I'm dead, rather than spend all my time at a facility that will replace me in a moment's notice the same day that I'm dead, you know? So, I mean, I'd rather spend time with people who it matters if something happens to me, than at a facility that's offering me money so that I can help fix their staffing ratios, which is not my responsibility. So it was just hard to explain this to them, but now I think I'm getting looked at as that person that doesn't want to help. So I don't know. But that is how I'm doing. I'm glad that I had that experience with the doctor, and then I'm glad that I got a chance to work on a separate floor, because it showed me that it isn't the end all be all. Even the doctor that comes to the fourth floor to take care of the COVID patients was very nice. Like, he would sit there and he would chop it up with the nurses in the nurses station, make jokes, brought us cookies. It was just a whole different experience than the second floor where I normally work. And sadly, on my first night on the fourth floor, the COVID floor, there was a patient that didn't make it. Like 15 minutes before the shift was over, there was a patient who they had to call a rapid response on. It was a patient in the room next to one of my patients, and he also had cerebral palsy. He was 42 years old, and then suddenly his rapid response turned into a code blue. He was not breathing, and just the room, people just rushed out of everywhere to try to help. And then I witnessed an interaction between a respiratory therapist and a doctor, and really helped me put things into perspective. But the doctor was going in, and I think he was, now that I think about it, I think he was taking in this machine that was going to help him to intubate the patient, as they were calling a code blue. But as he was taking it in, he realized he needed to wipe his down. So he got mad, and like the respiratory therapist was standing outside the room. So he was like snapping at him, like, I need the blah, blah, blah. And he was like, and the respiratory therapist just took a moment and looked at him because he was yelling at him. And he was like, not today, dude. Not today. Don't get no attitude with me. And then he like threw the machine, like rolled the machine at him. And the doctor just like had this look on his face like somebody finally stood up to him. And the respiratory therapist was like, I don't give a damn if you're a doctor. The doctor just turned around and like went about his business, but didn't say much, didn't say anything else to the respiratory therapist. But it was like, oh, okay. So everybody in this hospital gets talked down to, and it's refreshing to see when somebody does say something back because it provides an example of how you should talk. But then, I'm still confused because on the one hand, other nurses say to take it and respond professionally, but that respiratory therapist didn't really necessarily respond professionally. Um, he responded exactly the way I feel people should respond because it's ridiculous how some of these doctors talk down to you. But anyway, so that has been my experience within the past 2 days. I go back to work tomorrow, which is Thursday, and I also go back Friday. And then I'm off for the weekend. And a few days after that. But I've just started to just take it in. I feel like I've been on a vacation working on that COVID floor because there's been so much spare time to actually breathe. And now I'm going back to the second floor. And I just need to, being on that fourth floor kind of taught me that I don't need to start my shift right away after getting report. There's like 30 minutes before 8 o'clock. And 8 o'clock is the earliest you can start passing meds, like 1 hour in advance, because they're normally due at 9. So I think I'm just going to take my time, like I did on the fourth floor. There's no rush. Like 8 o'clock is fine. If I don't get report, if I have that charge nurse from day shift again who doesn't get the assignments up, when she should, I think I'm just going to take my time, go back to the nurse's station, actually look at my patients and know what's going on, and then start my shift and cluster my care that way. But we'll see how it goes. I also learned a lot about oxygenation when I was on the COVID floors and rock scores. I don't know if any other hospital does that, but it's a score that lets the doctor know how well the patient is doing on OptiFlow and how dangerously close they're getting to having to be intubated. So there's just a lot of lessons learned on the COVID floor. And just let me know that there's other things out there besides this second floor and that I can do it. I got so many praises from the charge nurses over the past 3 shifts. Like, it was refreshing to leave and them telling me that I did a wonderful job and like they hope to work with me again, and were surprised to know that this is my first time working the COVID floor. Like, I just felt really good. They probably say that to all the new grad nurses, but I just felt like, well, thank you, because for the most part my experience has been feeling shame when I ask questions, even though I'll ask it anyway, or feeling stupid, or it was just a whole different experience, and I'm glad that I had it. So I'm just gonna stay the course and do what I gotta do for the next year and possibly into 2 years, and just get that experience and move the hell on. And I know that I'm probably gonna experience a lot of doctors yelling at me within that time, but that's on them, really. And I say this now, but I don't know. I don't know how I'm gonna respond when I finally do say something, but it'll probably be along the lines of asking them to not speak to me that way, and being professional about it, hopefully. But anyway, other than that night when that doctor yelled at me, a patient told me that I was a wonderful nurse and she really appreciated me because the nurse prior to me did not really listen to her at all. And I guess those are the little paychecks that I get despite all the crap that's happening, all the chaos in the workplace. But anyway, other than that, still working on Capella, still on track to hopefully finish by February. And yeah, other plans, I feel like I want to go for my FNP, especially since California now has that new law where FNPs can practice independently from a doctor, I think after sitting under a doctor for 3 years. So I don't know, things are still up in the air, and we'll see what road I take. But yeah, that's my update that I wanted to give you guys, and I hope that you found this helpful in some way. If you're a new grad and you're struggling, we will get past this. We will get through it, and in a year's time, we will not be new grads anymore, and we'll finally have experience under our belts, and we can move elsewhere. And hopefully your hospital and your workplace is different and people talk to you with respect. I in no way want to make these videos depressing and make you feel like this is going to happen to you if you are a nursing student watching this, or a nursing student in your last semester. I want to try to make these videos as honest as possible, but also show you the level up, show you the progress of how I'm getting through it. I don't plan to leave. I'm not gonna leave unless there's like a really bad event that happens, but I don't want to scare you away. Being yelled at is not the worst thing ever. I feel like it'll either happen from the doctors, from other nurses, or from your patients, because the patients are in pain and they'll yell at you anyway. So you kind of have to take the good with the bad. But I am in no way condoning people yelling or whatnot, or yelling at you and taking out their stuff on you or on us. Just know that. But I don't want to discourage anyone from following this path just from my experience. Your experience may be different from mine. So don't take this and think that, and back away or shy away from what it is that your goals set you out to do. Anyway, hope this inspires somebody out there. Thank you guys for watching, and I hope you have a wonderful week. And if I don't update this by Christmas, a wonderful Christmas and a happy new year. Hopefully there's better things to come in 2021. Bye. Talk to you guys later. Bye.